Morning, everyone. We'll give it 1 second to get everyone from the waiting room in, and then we'll get started. Okay, I'm letting a few more people in, and then we can get going. All right, well, welcome and thank you for joining us this morning for our remote media availability. Today we are talking about the Colorado exposure notifications, and as with usual presentations, we're going to start with the presentation and then we will end with the Q&A. So please hold your questions until the end. Additionally, you'll see on your screen that we are delighted to have interpretation so that we can have some videos on. And so if you would like to adjust as necessary, we have it set so it's side by side. But if you need to adjust your screen to get what you need for the visuals, please feel free to do so. And I'm going to take it over to introduce our amazing participants. Next slide. So joining us today, we have Sarah Thunberg, Special COVID-19 Advisor for CDPHE. And then joining us for the Q&A a little bit later, we'll have Jenny Wenger, Public Health Technology Expert for Linux Foundation Public Health. And with that, I'm going to take it over to Sarah. Next slide.
Hi, everybody. Thank you so much for joining us today. I'm incredibly grateful for you being here, and I'm super excited to talk about Colorado exposure notifications. Before I launch into that, I just want to acknowledge that our state is struggling at this moment with intense fire across the state, and I wanted to acknowledge that and say on behalf of everybody at CDPHE, our whole team who's working on COVID, and I imagine all of you from the media, our hearts go out to the firefighters filled with thanks and gratitude. And we hope that we have good weather soon and the fires abate. So just wanted to acknowledge that this is an incredibly difficult moment across Colorado for a number of reasons. So on the good news front, it's a pleasure to talk today with you all about Colorado exposure notifications. This is a new technology service developed in partnership with Google and Apple that will help us slow the spread of COVID-19. This service, a mobile phone enabled service, can alert users if they've been near somebody recently who's been diagnosed with COVID-19. This helps us know about possible exposures and enables people to take protective actions such as quarantine, isolation, and testing that limits the risk to their loved ones and the larger community. This is a game changer for us in Colorado. Next slide, please. So exposure notifications requires individuals to enable the service on their mobile phone. But one of the most exciting things we've learned is that exposure notifications can slow the spread at any level of adoption. We want everyone in Colorado to enable this service, but we've seen recent research out of Oxford that shows at any level, even the smallest level, we can have advantage that helps us slow the spread of COVID-19. Next slide, please. One of the most exciting statistics and one of the most exciting outcomes of this Oxford model is that with just 15% of individuals in any community adopting and enabling the exposure notifications technology, we can experience an 8% reduction in infections and a 6% reduction in deaths. As we're seeing cases, hospitalizations, and positive test results surge across Colorado, we are so excited to have this new technology in the toolbox to help us fight COVID, and it can have a marked effect. Next slide, please. So let's talk for a second about how this service works. Next slide. So we're going to use a great example. This is Alice and Bob. They don't know each other, but they're having a lengthy conversation. Instead of sitting on a park bench, let's imagine that they are skiing and they ended up on a lift together and that lift broke down. It's a beautiful day and they're having a gorgeous, wonderful conversation, enjoying the scenery. While they're doing that, their phones, their mobile phones, are exchanging non-identifiable tokens. Strings of random letters and numbers that change frequently. They're exchanging those back and forth in the background. They get off the lift, they go about their day. A few days later, Bob's not feeling great and he gets a COVID test and it comes back positive. He gets a call from a contact tracer, a traditional, very successful disease control strategy we use is case investigation and contact tracing. So Bob's contact tracer calls him and asks him a series of questions, including a new question in Colorado, which is, do you have exposure notifications enabled on your phone? Bob says yes. And that case investigator, with his permission, sends him a link via a text message. That link then enables Bob to click through a few questions, and a server then sends a text message to everybody who he's exchanged, every phone really, that he's exchanged that random string of letters and numbers to, and says, you've likely been exposed or possibly been exposed to an individual who's recently tested positive for COVID. Sorry, next slide. I jumped ahead. In this case, Alice is home. Also, she's reading a book. She's having a great day. She feels great. And her phone buzzes and she gets a notification that says, you've recently come in contact with somebody who's tested positive for COVID. Tap this message for more information. And in that, she'll be linked to information about how to isolate and quarantine and get testing, how to take care of herself. So that completes sort of the experience for them. Next slide, please. One of the things that's really important here is that exposure notifications can rapidly notify known and known contacts about a potential exposure. So what we see here is a little bit different version of Bob. And we see the difference in what the game changer is of this technology. So Bob lives with his roommate. They see each other every morning. They share coffee. They have a great day. Whatever they do, they share space every day. So when Bob tests positive, he knows that he's possibly exposed or likely exposed his roommate. And he knows who his roommate is, obviously. So we can say, hey, man, I'm COVID positive. You should probably get tested and you need to now quarantine for 14 days. So that's really easy. That's a smooth process. We know that who we're personally in contact with, our friends and our family, and the people we live with, and we can tell them about that. A little bit harder is that if Bob maybe had a conversation at a cafe with a stranger, and had a conversation, and at the end they said, "Hey, I want to meet up with you again," and they exchanged phone numbers. When that contact tracer called him, Bob could give that person's phone number and say, "Hey, yeah, I met this other person. I do have their phone number. Could you let them know that they might have been exposed?" That's how we do case investigation and contact tracing now. So we have sort of two layers of success. But one of the things we really struggle with, and it's especially challenging because of the asymptomatic nature of COVID-19 transmission, is that if Bob took the bus to work and it was a unexpectedly crowded day on the bus, he wouldn't know those people he sat near, and those people wouldn't know that they had sat near somebody who had now tested positive for COVID. And this exposure notification can bridge that challenge by anonymously notifying people that they've come into contact with somebody who's tested positive. So it gives us another tool in the toolbox. It's very exciting. Next slide, please. So we've been watching and waiting in Colorado for the right time to launch exposure notification. And one of the key things we really wanted to ensure is that the service was completely secure and privacy protected. So there are some key things here and some key reasons why we think this is the moment and this is the right app to do it with. So first of all, users have full control of the service. They can opt in to use the service. They can opt in to receive notifications, and they can turn it off at any time. If you can turn it on for a little while and turn it off, it's totally up to the user. Additionally, the service will never track your location. It uses Bluetooth, not GPS, and none of that data, that random string of letter and numbers, it has nothing to do with your location, has nothing to do with your identity. It doesn't store, transmit, or collect any personal information. So your identity is never revealed to anybody. Next slide, please. So let's talk a little deeper into the experience, how Coloradans will experience the app and how they can engage with it. Next, please. So beginning on Sunday, October 25th, this Sunday, users of Apple and Android mobile phones will begin receiving a push notification asking them to enable exposure notification services. Starting on Sunday and then trickling out over a couple of days, people will receive this push notification as you see in the middle image. iPhone users will be able to click on that and walk through a couple of steps in their settings to opt into the service. We're going to watch a short video now, which shows this process. So you'll go to your settings, scroll down, click on that icon that says exposure notification, slide the button. You will then scroll all the way down to the bottom to select United States, and then select Colorado. We'll then walk you through a series of opt-in slides. Turn on exposure notification. It will tell you how it works, and then you're done. And similarly, if for any reason you need to turn it off, you'll go back to your settings and you'll slide it back on, back off. It's very similar to turning on Wi-Fi, airplane mode, anything like that. Same sort of area. You'll just slide the button on and off for exposure notifications. Please turn it on though. We all need everyone to do it. Next slide. The experience on Android is a little different. So you will receive the push notification. You'll click through. It will take you to the Play Store and then walk you through. We're going to watch a short video now about that part. So it'll take you to the Play Store. You'll click open. And then the service will walk you through 3 separate opt-ins. One is about turning on the service itself. One is about helping in Colorado. So it's a Colorado specific, getting the exposure notifications themselves. And the other is an anonymized analytics piece. That's standard App Store, Google Play Store language, so they can make the app better. And then you'll have it. It's a separate application rather than iPhone where it's just a turn on and off. It is actually a separate application in Android, but super simple process. Next slide, please. So once you should you test positive, we're going to talk through the process by which you will share your result anonymously with those individuals who also have the service enabled, who you've crossed paths with recently. So again, if you test positive, you'll receive a phone call from a case investigator or a contact tracer in your county or from your local public health jurisdiction. And in that conversation, they'll ask you, do you have exposure notifications enabled? And would you like me to send you the link that allows you on your phone to send a notification to those who you've exchanged those tokens with? If you say yes, you will receive a text message with a link, and that link will allow you to go through a process that enables that sharing. Again, no personal information. Nobody will know it was you as an individual or the location. So we're going to watch a short video about this piece as well. So you'll get a text message. You'll click through the link. It will walk you through. You've tested positive. It asks if you've traveled in the last 14 days. If you say no, you then review your information and you share your COVID test results. You can click share then, and the process is done. You've done an incredibly good service for those strangers and those individuals who you've crossed paths with, and you've notified them to take protective action. It's an incredibly generous act in this very difficult time. Next slide. And then on the other side, somebody receives an exposure notification. It again comes as an alert on your phone, and it shows you, we're going to watch a short video here as well about the process. So you get an alert that says somebody you know, somebody you've crossed paths with has recently tested positive. Click for more information. You click for more information. It takes you to the public health department site and it says possible exposure. It gives you the date that you might have been exposed and more information. The Department of Public Health and Environment encourages everybody who receives an exposure notification to get tested. In that link that you receive on your phone, it will link you to a map, which will show you free, easy testing locations across the state that you can get tested. Additionally, in that link, it will provide you information about quarantine. As an individual who has likely been exposed to COVID-19, we ask everyone to self-quarantine immediately. Next slide, please. So we ask you to add your phones to the fight against COVID. Next slide. Again, wrapping up, I cannot emphasize enough how exciting this is and how much we need everybody in Colorado to add their phones to the fight against COVID. A reminder that this service is available beginning this Sunday, October 25th. It's quick and easy to opt in. It will equip each of us to play a role in protecting our family, our friends, and our communities while maintaining strong individual privacy. And to learn more, please go to addyourphone.com. Next slide, please. And now,
thank you so much, Sarah. Now we'll go ahead and move into our Q&A portion of the presentation. And to do this, we'll use the raise hand function. So those of you that may have not done this with us before, when you go to the participants at the bottom, You'll see the little hand icon. You can use that to raise your hand so that I know you want to ask a question. I'll call on you. If you can go ahead and say who you are and what outlet with, that would be wonderful. And then I would also say that if you have any questions on a different topic or any questions that may be a little bit more in depth, please feel free to email those to media_info@state.co.us. And now I'm going to go ahead and take it over to Marianne. And then thank you, Jenny, for joining us for the Q&A.
Okay, can you hear me?
Yes.
Okay. Yeah, my question is, when someone tests positive, they can choose to share this result. That seems to sort of defeat the whole purpose of things if they're not, I mean, you know where I'm going here? It seems odd that this is a sort of a self-reporting thing. It just seems to me that a lot of people may not want to say, yeah, I've got the Rona. You know, that is a concern. What's your response to that?
Sure, absolutely. I think one of the things that we find really powerful about exposure notification is the privacy protection component and the opt-in. We want to ensure that everybody maintains control of all of their experience here. And so the other thing that's really important is that the service itself doesn't collect or link data to anybody's personal information, including their positive test. So the only way we can have this technology and have it be so secure and privacy protected is to not actually link any result with the technology itself. It has to be opt-in to achieve that level of privacy protection we really want. So we really want people to opt in and to opt in to share their status. And one of the things I think is important is that no one's name is connected with that notification. So when opting in and saying, yeah, I tested positive, share this with essentially with the phones that my phone has crossed paths with, is nobody can ever back that up to you. Nobody can ever trace it back to an individual. So we think it offers the right balance of privacy and protection on both sides. And that's the best way we think we can do this.
Great, thank you, Marianne. Any other questions? You're a quiet group this morning. Oh, good, Marianne, we'll take it right back to you. Thank you.
This was something, why did it take a month longer to get this rolled out? Because this was supposed to be out, as I recall, about the end of September. What caused the delay?
Yeah, so we wanted to ensure that we had everything set up for a very seamless user experience. And in Colorado, we have a distributed locals first public health system. So we have 56 local public health agencies and 2 tribal health authorities. Don't quote me on that number. I think it's right. And we needed to work with each one of those to enable them to be able to engage the service and engage their community members to get them the right link. So we wanted to get that experience right and make sure it was seamless and smooth. And it took a little while. So we spent time and invested, and we are really glad we did.
I'm gonna throw out another one here. In rural Colorado, cell phone service is not always the best. How are you addressing that particular issue?
Yep, absolutely. So one of the great things about this technology is it operates on Bluetooth. So it doesn't need signal a connection to the whether it's AT&T or Verizon, you don't actually need that signal. It's the Bluetooth enablement on the phone itself, and 2 phones that have Bluetooth can connect to that. So I might ask Jenny to correct me if I'm wrong here and to add something, but I believe that even if you, for example, turned off your signal, as long as you enabled Bluetooth, the technology would still work. And so it doesn't actually need that signal. Is that correct, Jenny?
Yeah, that's correct. So the phones communicate with each other via Bluetooth, and everything is stored locally on the phone. There's no reason that a phone needs to connect to the server. The only time that you need either to be hooked up to Wi-Fi or to some data signal via your cell phone provider is to receive the numbers from the server to know whether anybody near you has reported themselves positive, and then to upload your own numbers if you do need to report positive yourself. So during day-to-day interactions, you don't need a cell phone signal. And then only at those moments in time, ideally, once a day, if you can connect to the internet, that's really all you need.
Great, thank you. We're gonna go with Elena.
Oh, hi y'all. 2 questions. One, what are you looking for in terms of participation? How many people using the service would be successful? I don't know if you have like a 6-month timeline, a 2-month timeline, a first day sign up timeline. And then also, what are you hoping this app does for, over the next couple of months?
Yeah, so we are in a place of wanting everybody to download it as fast as possible. We recognize, and we've observed from other similar technology launches, that the moment that push notification goes out is really the moment to engage people at the highest level. So we want to get the word out before the push notification comes starting Sunday. So people, when they get it, know what it is and know how to use it and know how privacy protected it is. So that's part of the reason for this conversation today, is we want to get the word out so people aren't surprised when they get it and they can enable it. The other thing I would say is that we want, again, as many people to use it as possible, but we've seen the modeling that adoption at any level is hugely significant. I would say that as the lead for contact tracing, case investigation, testing, as well as technology on COVID for the state, I want to see no less than 15% adoption, because that has an incredibly meaningful reduction in our transmission and in our fatality rates. So I can't say it enough that we need everybody to do it. And at the same time, even just a small adoption, 15% of Coloradans, can have really meaningful life-saving effects.
Great, thank you. John, we're going to take it over to you.
Great, thanks. I'm sorry if I missed this. Did the state put any money into developing this program or these programs?
No, it's an incredible public benefit that Google and Apple together have developed. The technology, the service itself has been made available to the state for free. The Colorado side effort is enabling that link notification and working with our public health partners to be able to use it. But no, we did not pay to develop the application. It has been made available to us from Google and Apple. Very exciting. We are grateful.
Great, thanks.
Great, thank you. And if you guys can say your name and your outlet, that would be wonderful. Now we're going to take it over to Ray.
Hey there, this is Ray Ellen Bichelle with Kaiser Health News. In the modeling paper from Oxford and Google, that's based on 3 of the largest counties in Washington state, it looks like. Can you tell me a little about how you know that those findings would be transferable to our populations, or if you think they're most transferable to just certain populations within the state?
Yeah, it's a good question. And I would say that with any modeling, we need more data, and we're very excited to measure and evaluate over time what exposure notifications does in Colorado. But it is the best application we have now. And so we are optimistic. that modeling can carry over and hold true for what we see in Colorado. And if everything goes well, hopefully it's even better, because we could really use some stronger tools in our toolbox.
Great, thank you. Mary Ann, I'm going to take it back over to you.
Thanks. Thank you for your latitude and letting me ask lots of questions here. What's the, how much is this going to help contact tracing in Colorado? And my second question is, what is the percentage of cases that contact tracers can reach in, say, a 48-hour period right now?
So this is, I like to think of our response a little bit like we're doing the Swiss cheese model of disease prevention, where testing does one thing, but there are holes. Then case investigation does another, masking, social distancing, and nothing is 100% effective at this point in reducing disease transmission. So we need to put as many of these things together and sort of line them up so they overlap, so we cover the holes with another one, and eventually we get to a really effective strategy. And so this technology, this service is actually separate from contact tracing. We connect to individuals who use the service through a contact tracing call and give them the link they need to notify people, but it is in addition to contact tracing. And it sort of extends the contact tracing process to people who you don't know their name or their phone number or how to find them again. Case investigation and contact tracing is only as good as the information the positive individual can provide. If they can remember who they've come into contact with and they have phone numbers and names for those individuals, that process is really, really good. But if you, again, are on that city bus experience and you are close to a lot more people than we would recommend, which is we want everybody to be 6 feet away from each other. But if you're close to too many people and you move on with your life, this is the technology that allows us to notify those individuals that they've been exposed. So it's sort of another layer of support and also an extension. Then to answer the question about case investigation and contact tracing, the current metric we strive for at CDPHE and in support of our local public health agencies is that we complete our first case investigation call for every individual who tests positive within 24 hours of that positive notification to public health. We want to get at least 95% connection. Obviously, some people don't answer the phone. Again, we want everyone to answer the call, but if people don't answer the phone, we can't do case investigation and contact tracing. So it's 95% within the first 24 hours of public health's notification of the test result.
Great, thank you. Ray, we're going to take it back over to you.
Thanks so much. This is Ray with KHN again. Apologies if you just said this, and this is repetitive, but there's sort of a recurrent theme in a lot of states about trust issues and how contact tracers are having a hard time getting through to people and getting them to cooperate. What are some of the metrics that you have about how that's going in Colorado, uptake-wise, trust-wise?
Yeah, unfortunately, I don't have any of those metrics at hand. I think I will let the media team get back to you. I'm sure we can pull something and get it for you. I don't have it at hand, but I would love to kick it to my colleague, Jenny, and have her answer sort of what she understands or what she's observed about the privacy protection here and how that links to adoption and how we can overcome some of that distrust with a really secure app or service.
Thanks, Sarah. So one of the things that's really nice about the exposure notification technology is how privacy preserving it is. And so back to Sarah's discussion of the Swiss cheese strategy, one of the things there that we've seen happen in other states is that some people who might be less comfortable talking to contact tracers in person for whatever reason might be more comfortable sharing anonymous data with an app. And so you can actually also target different demographics that way through having a very privacy preserving option for them to share their status and to report out what's going on with other people. It can also be a way for people who don't want to, for whatever reason, they don't want other people to know about their status. They can still notify friends, and they can notify friends and acquaintances via the app if that friend is also running the app, without having to have that contact tracing process go through. So we've seen it be really advantageous for getting to larger populations because of that. On top of that, we've emphasized the privacy preserving status of this app throughout this conversation. And it really is to the point where even if somebody were able to see all of the data getting uploaded to the server, all they're going to see is random numbers that are completely unattached to one another. So there was really no way to identify somebody to get their information out there or anything like that. I also do, in terms of getting to other people and that accessibility, it's also one thing to note is that the app is going to be available immediately in English and Spanish, and that the department is working on additional languages as well. And so, there's all of these different ways in which this app provides the means to create more accessibility, to reach more people, and it's another tool in the toolbox for fighting the disease.
Great, thank you both. And Ray, if you want to send your question over to media_info@state.co.us, we can follow up with any specifics. Marianne, I'm going to take it back over to you.
I just want to follow up on the question I asked previously. Sarah, you said that your goal is 95%. What's your actual? What is the rate right now?
We're at 95%.
Oh.
Yeah, 95% within 24 hours across what we call the COVID containment response score. That's CDPHE's own internal case investigation and contact tracing arm. We make that in service to our local public health agencies. It's surge capacity. It supports local jurisdictions who don't have a big case investigation and contact tracing team. We are delivering on that metric, and we're really, really proud of that work.
Great, thank you. Any other final questions before I let you all go for today? Yes, Ray, one more.
Yeah, thanks. You mentioned earlier how part of the delay had to do with talking with tribal authorities. Can you go into some examples of what were some of the issues that you were discussing and smoothing out?
Sure. I would say that it wasn't specific to tribes or local public health jurisdictions independently. It was just ensuring that the system by which we enable contact tracers and case investigators in any jurisdiction to send that notification, to give them the keys that unlock the code. We wanted to make sure that process was useful and functional and really actually very simple for every jurisdiction, no matter which one. If we had other jurisdictions, for example, have one single public health department that covers the entire state. In Colorado, we don't have that system. As with everything, we have everything in Colorado. We're a home rule state. Local jurisdictions by statute have authority for case investigation, contact tracing, and any communicable disease investigation work, including for COVID. So we needed to ensure that the strategy we used, this linking strategy, this code distribution, worked for everybody. So it wasn't specific to any jurisdiction. We just wanted to work it out and get it right. And it was worth making sure we did that so we didn't accidentally mess it up.
Great, thank you. And then we did have a quick question in the chat about working with school districts on the rollout. Would you guys like to add anything about how this will roll out with that?
So it's a statewide rollout. As of Sunday and moving into it, as of the 25th, anyone and everyone in Colorado can enable the service, whether you are a teenager with a phone, whether you are an adult, a teacher, a student, and we want everyone to do it. So parents, we would like to encourage you, if you have provided your minor with a cell phone, to enable this technology. We want you to do that so that we can help keep your kids safe, keep you and your kids. We know that young people aren't always the best at not gathering. We're seeing that in the data. So this is another strategy in our approach to help protect people. So we'll be working directly with all sorts of stakeholders, school districts, colleges and universities, our resorts who are going to welcome tourists back for winter sports season, our sports teams, for example, the Broncos. We're working with all of these stakeholders to get the message out, to have people enable the technology and put their phone in the fight against COVID. And school districts are just one of those.
Great, thank you. Okay, Marianne, I'm gonna let you have one more.
Thank you. I appreciate it. You mentioned at the beginning that you had 56 local public health jurisdictions. Is that all counties or is that municipalities? And given that we have 64 counties, I'm wondering what you're doing to reach out to those who are not yet on board with this.
So in certain areas, for example, Tri-County Health in the metro area covers 3 counties, as the name suggests. So that's why we can have fewer local public health agencies than we have counties. Additionally, San Juan Basin Public Health, I think, covers 2 counties. There are areas where counties have come together and decided to share the public health resources and work together in a consolidated way. There are just some examples of that. So we have worked with all of our local public health agencies and made this service available to them in this very easy process. We've done a ton of stakeholding. I talk to the local public health directors at least once a week, and this has been a robust part of our conversation. So we will continue to do that. Incredible partnership and incredible collaboration that we have with our local public health agencies to ensure this service is available to everyone in Colorado. And I would also add one more plug here is that when tourists arrive, they are able to enable the technology. If it works, if they have it from another jurisdiction, it will work here. But if they haven't enabled it, we're going to ask that they do. We're going to do some marketing campaigns and some advertising work to notify people that when they come to Colorado, we want them to use this service if they don't already have it.
Great, thank you. And before we close out, Jenny or Sarah, do you have any final thoughts you want to add?
I don't. Thank you so much for joining us. I'm incredibly grateful. Turn on the service on Sunday.
Wonderful. And so thank you so much for joining us. And thank you, Sean, our interpreter. We appreciate you. And I hope you all have a wonderful afternoon. If you have any additional questions, please send them to media_info@state.co.us. Thank you.